All right, I'm going to go ahead and record the EMAR portion of the IM checkout. The checkout is going to be similar to the practice one you have. Hopefully you can see this. I know it's hard. I apologize, but do not view this video until you have actually looked at the PowerPoint and the different videos, that I put in the PowerPoint. This should be the last video you view. This is putting it all together. I won't be going over everything since you have videos of a lot of it already and PowerPoint audio about a lot of it. So if we look at the practice that you have that at home on your in your blackboard. You have the today's date. You have the time is 7:30. You're in taking care of Thelma Jones. She's got pneumonia and she's got a fracture of the right rib. She has a history of diabetes for which she takes insulin, so you're probably going to be giving her insulin. You give them a report on her, and the past nurse says she's doing well, although she does have pain in her right rib occasionally, and she's getting Toradol. I am for that, so make sure you look up Toradol so you know what kind of medicine that is. And it's been working well. The last time she got her pain medicine was 1 o'clock. Remember, on my little EMAR, you can't go back to see when the pain was, so you'll have to get it from the report when the pain medicine was given. The past shift also tells you the doctor ordered a TB test to be given. They tell you that the order was sent down to pharmacy, it was verified and all, but they're just waiting for pharmacy to deliver it. Not uncommon, you're waiting for the medicine to be brought up into the drawer. Also, the past nurse tells you that, the CNA that you're working with tells you that she went ahead and did a blood sugar check for you this morning. They have blood sugars AC ordered before breakfast, before meals, and at night. And her blood sugar was 301. Also, the trays are on the floor. The reason why I say that, you wouldn't want to necessarily give them their insulin if the trays aren't on the floor in case their blood sugar drops too low inadvertently and you have to give them their food, right? All right, so she also just called up to the nurse's station to request her pain medicine. So we'll be giving her something for pain. So proceed to give the appropriate medications that are due. Just like in checkout, you'll have a scenario and you'll have the doctor's orders on the back. So the first thing we're going to do is we're going to go to the patient's EMAR. A lot of this obviously is the same for your oral meds as it is for the injectable. I want to show you a little bit because of the EMAR, even though it's a little different, it's the same, even because we have the mixing of the insulin. I want to show you how that works in that. All right, so I always pull up the patient and I verify the patient's name with the doctor's order, with their chart, the Thelma Jones, and her birthday. Date of birth is January 1st, 1933. I also check to make sure there's no allergies for the patient. She has an allergy to aspirin, so I keep that in mind. Then I'm going to scroll down and make sure all of the medicines have been verified. Every medicine says verified DAK, DAK. So that means somebody has checked that off. Every single one. That's the first step before I start pulling out meds. All of that is done. So then I can start pulling out meds. Since it's 7:30, we're going to be giving her 7:30 meds. And the first one is the NPH in drawer 6. This is, I know I talked about this in the video, the PowerPoint. The ideal situation from the CDC is that each person has their own medicine. So that is how we are going to, has their own insulin. So that is how we are going to do that for checkout. Now, obviously for insulin pens, everybody has their own insulin pen, but it's the vials that I'm talking about. All right, so we're looking for Thelma Jones's NPH. So I have Thelma Jones's NPH. The first check is here. The second check, NPH. I can't get the 10 units yet until I pull it out of the drawer. Okay, so that comes when I pull it out of the vial. So at this point, I'm checking just to make sure it's the NPH and it's Thelma Jones's and it's not expired. All right? Okay. I'm going to put it aside because I know that I'm going to be mixing it with the next one I have. She's a sliding scale. The next one is Aspart Novolog insulin sliding scale, sub-Q. Blood sugars, and it gives you a whole range. Now her blood sugar was, go back and look, it was 301. So according to 301, her insulin, she should get 8 units at 7:30. So I'm looking for Thelma Jones's Novolog Aspart. Bring it up, check it again. patient, time, med, dose, route. So the route is sub-Q, so it's going to be an injection. The med is insulin. The dose is going to be the 8 units. Med, patient, time is 7:30, med, dose, route, sub-Q. So we're going to mix these together. Now you can pull out everything in the drawer if you want, or you can mix them now. All right. So I'm going to go ahead and pull out everything. Albuterol, 0.8%, give 2 puffs every 4 hours at 8 o'clock. It's 7:30. You have a half hour before and a half hour after. If I need to be efficient, as one of the things I need to do is be efficient as a nurse. So if I wait till 8 o'clock, there's no reason for me to wait. I would be walking up and down the halls every minute if I waited to do that. Since it's a half hour before and after, I'm going to pull it. You need to also learn to be efficient as a nurse as well. So drawer 5, I'm looking for that patient. You wouldn't want to use another patient's albuterol because they could be putting it in their mouth. I mean, obviously it's an infection control issue, so they should have their own inhaler. All right, so I'm looking for Mrs. Jones's inhaler, albuterol. First check, bring it up. Patient, time, med, albuterol, dose, 2 puffs of this 0.83%. And route is going to be an inhale. All right. Okay. And then if I think she needs a spacer, I will bring a spacer along with her. So she would have a spacer that would be already hers that you've gotten for her, or if it's a brand new one, you would get it ordered through respiratory care. Okay. All right. So the next one is something I have to give at 9 o'clock. It's an IV, but it's 7:30. An hour and a half is too long, so I'm not going to give that one yet. Okay, the purified protein, it's been signed off, but it's not been given. It's one of those, it's a 1 dose, give times 1 and record. So I am going to go ahead and pull that one. Usually, I put this in a vial, but usually it is not in a vial. It's already pulled up in a medicine dose, and you give it per pharmacy protocol. That's not atypical, but that's how they order it, and the pharmacy will tell you how to do it on the package, but it's usually 0.1 underneath the skin. It's intradermal is what is ordered. So, but usually they pull it out, and then you're supposed to, after you give it, you circle it, you come back in 48 to 72 hours and read it. All that goes into the chart. All right, so at this point, we're going to pull it. You're not going to do intradermal for checkout, just so you know. All right, so I'm going to pull that first check, second check. Check the expiration date. Oh, I forgot to check the expiration date on that. Expiration date. All right, and I'm going to be giving 0.1. I'll put that aside. And then the next medicine, I know I have to give a pain medicine to this lady. She had pain. She had given it at 1 o'clock. It can be PRN every 6 hours for pain. It's the only medicine I have to choose from. Remember, we talked about this before, is usually you have more than one choice. But in this case, I only have one choice. I'm looking for ketorolac, trimethylene, Toradol, 30 milligrams IM as needed for pain. Do not exceed 120 milligrams per 24 hours, which so far I have not. It's just only ended at 1 o'clock. All right, so every 6 hours, 1 plus 6 is 7 at 7:30, so I can give it. All right, I'm looking in drawer 2. Now, this is not a narcotic, but if it was a narcotic or controlled, you would have to, if you waste anything, you have to, or when you're pulling it out, there's a narc count where you see how many you have and then how many after you remove it and all that. But this one is not, so we don't have to do that for this. But make sure you understand how that is done for when Lacey taught you that. You guys will be doing that in clinic. You're not going to do it for checkout, but that is something you will need to know when you give narcotics or any controlled substance. So anyway, first check, second check. On this vial, you can see this. On this vial, it says ketorolac, basically trimethoprim, 15 milligrams per ml. I need to give 30 milligrams. So there is a little bit of math I need to do. So if you have trouble with that kind of math, you do need to have a second person check you. But I don't have trouble doing 15 milligrams per ml. If I have 30 milligrams, that means 2 mLs. All right, so my first check, my second check. Check the expiration date. All right. So that is what I would do, how I would go about pulling my meds from the drawer. And then I'm going to decide to mix it. So I've done a first check and a second check. Now, The insulin, I wasn't able to check the dosage. So it's kind of not really a third check because I've never really checked the dosage. So I have to, in between when I mix, I have to go back and check the dosages on the insulin. So I have to check those as I'm mixing. So on these ones are brand new, so I'm gonna pop the cap off. And I did this in a video for you already, all right? But I'm gonna roll the NPH, and then I'm going to select the appropriate insulin syringe. It's only insulin that I can have for an insulin syringe. Then I'm going to, after I roll that, I'm going to clean the vials. One alcohol swab, and I'll pretend like I opened another one for the second alcohol swab. I'm going to draw up the put air into the NPH. In this instance, I need 10 units. 10, inject 10 of air into the NPH. Inject 8 units of aspart. Inject 8 units of air into the aspart. Turn it over, pull back and get my aspart. All right. Then I come back and I check to make sure it was 8 units that I needed. His blood sugar was 301, 8 units of her blood sugar, aspart, and I show a second nurse. I'll be for checkout, I'll be your second nurse. All right, so then I can move that aside. We're gonna scan it in the room. So then I need to get my NPH of 10 units. I've already put the air in it, so I just need to put my needle in. And I count 10 plus 8 is 18. So then I go down to 18 units. Once I've gotten the air, I shouldn't get any more air. All right, make sure I have the NPH was 10 plus 8, 18 units. Second nurse checks. All right, then I would want to scoop my insulin cap on. I don't want to poke myself on like this, so I'm going to scoop it on. You can scoop, you can recap a needle when it's not been in a patient, like when you can't carry it down the hall, like, you know, poking people in the eye. All right, but you can't recap it after it's been in a patient already, because then you have to put the safety on and throw in the needle box. All right, so I'm going to go ahead and get my, I'm not going to go ahead and do this, but I'm going to go ahead at this point and draw up my protein curative derivative, and I would go ahead and draw up my, so I would draw up my protein clean swab, put 1.1 of air into it. You guys get the idea. 0.1 of air into it, bring it back, and have that. And then on the 2 mLs, then I have to ask myself, well, 2 mLs, it's a pain medication. Where do you think I might give that? I think I'm going to go to ventral gluteal for this spot, because that's the preferred spot for the ventral, for giving a pain medicine to an adult patient. Then I ask myself, well, how thick is this? Not very thick. Okay. Then I ask myself, where should I put 2 mLs? I've decided 2 mLs ventral gluteal. Can it go in that spot? Ventral gluteal? Yes, it can. Then I ask myself, is this person a normal adult-sized patient? If she's a normal adult-sized patient, I'm going to go on ahead and go a 1.5 inch needle. So that's what I looked for, the 1.5 inch needle. 1.5 inch needle, and the gauge happens to be 22. That is an IM needle. I turn it up, tighten this needle. I'm going to clean. Again, I'm not going to go through everything. I'm going to go ahead and put 2 of air in, inject it, pull it up, get my 2 mLs of fluid. All right. And then the same thing with this. I would scoop it. Because I have multiple needles, I would label all of these, and I'm going to go in the room with them. Once I get in the room, I identify myself. I open up a computer in the room. I've got my stuff with me, and I put my time in the 7:30 box, this little cursor. Hi, my name's Debbie. I'm going to be your nurse today. Can you please tell me your name and date of birth? I open it up and I look at her armband. Yes, my name is Thelma Jones, and my date of birth is January 1st, 1933. So then I check that against the EMAR. Yes, her name is Thelma Jones, and date of birth is January 1st, 1933. Mrs. Jones, do you have any allergies? Oh, yes, I have an allergy to aspirin. It makes me have a rash. So then I look to see she's got an allergy to aspirin, and that's what's on her armband. So then I'm going to go ahead and further identify her by scanning her armband. Okay, so then I look to see, does that number compare to that number? Again, remember, that's not really how it works in the hospital. It'll just come, it'll go E or flash or do different things to let you, or say flash your name. It'll let you know that you scanned in correctly and this is really the right patient. So now I've done 2 checks of all of those. Remember I told you it's an extra check, but it's not really an extra check with the insulin. It's kind of a third check, kind of not. I need to do my 3rd checks and scan before I give my medicine. So that is what I'm going to do. I'm going to put a 730 cursor. I'm going to look at my NPH. I got 10 plus 8. I'm going to go ahead and scan the vial. Make sure that that number matches that number, and it does. I'm going to go on down, scan, do my 3rd check, 10 plus 8, 18. Make sure it's the right vial. Scan my vial. That number matches that number. And her blood sugar, since it's a sliding scale, her blood sugar is 301, and I gave her 8 units. I typed that in because I need to know that what her blood sugar was and how many units I decided to give her. And then I'm going to go ahead and scan her albuterol, do the 3rd check, make sure it's hers. Yes, it is. All right. Put your cursor in this 8 o'clock box and scan. This number matches this number. The 21457 matches the 21457. I go down and I do the same thing. Oops, the purified protein derivative is supposed to be at 8 o'clock, not 9 o'clock. It was a one-time order. So I put in the 8 o'clock. Protein. I check the patient, the time, the med, the dose, the route, and I scan it. And they should have labels on this, the actual syringes as well. And then I'm going to go down to the pain medicine every 6 hours. It's 7. I can give it. She's got, ma'am, can you please tell me the pain level on a scale of 1 to 10? Oh, honey, my pain's a 6. So I'm going to record that as well. I don't need to put the time under here because when I scan, the time automatically goes in when it's a PRN like that. So turn on 15 plus 15 is 30. So I have 2 mLs in my syringe. I've got the correct needle. All right. I would go ahead and change this needle and make sure I put another 1.5 inch on there. So since I'm going to do a Z-track on her, I don't want the needle to have medicine on the outside of it as well. So it would be a fresh new needle when you're doing a Z-track. All right. 15, no, that's 2. All right, so then I'm going to scan it. Oops, I had the wrong box. That's not good. Let's get rid of that. All right, put this in the wrong box. Scan. All right, and her pain level was a pain 6 out of 10. All right, out of 10. The time went in and my initials basically went in. They don't show initials, but it's already under your name. So I've got everything scanned in, then I would get ready to give the medications. And that I've already showed you in the PowerPoint how to give the medications. I would give the intradermal, I would give the sub-Q, I would give the IM. I'm going to give the IM ventral gluteal, and I would also use the inhaler and teach her how to use it. I would probably, if it's a brand new inhaler for her, go ahead and get a spacer for that as well. But like I said, I already showed you that, so in the interest of time, I'm not going to show you that again. All right, we will practice when we come into the lab. We'll practice all the skills. We won't necessarily have time to get on the computer, but I do have an open lab time the following week after that you can get on the computer if you would like. The computer is very similar to the oral meds. The only thing is you have to check in between when you're doing the insulin. That's the biggest difference, is checking in between when you're doing the insulins and making sure you're bringing the vials and scanning them with you when you go in and check. Do not forget to scan your medicines. I can't pass you if you don't scan the medicines when you're in the room. That is part of the third check. Thank you.